A very good afternoon to everybody. Thank you, Dr. Bhattacharya, for the opportunity. I'm Dr. Medhi from Guwahati. When you leave a surgery at this point, the next day morning you want to see good things. This is not something that you look for. So an uneventful surgery done, oh my God, why this storm next day? So why do you have cloudy corneas? What can be the reason? No financial disclosures. So here are some scenarios that I would like to share. We can have a cloudy or hazy cornea on the first post-op day. It can be total or sectoral. When you try to look closely in the anterior chamber, there is no reaction. If the edema is too much, you cannot see beyond the corneal stroma. But if you try to look very hard, you might see some flap-like thing floating in the anterior chamber. What could this be? And if you have access to a tool like an AIOC2021-GP74-Topic-Dr.Jnanankar, you might find the descending membrane which has got detached and hanging in the anterior chamber. So this could be a reason for your hazy corneal edema on the first post-op day. As I said, it could be sectoral also. Here in this case, you can see only one part of the cornea is edematous. When you do a slit lamp examination, you can find the detached descending membrane which responds very well to your air tamponade. Second scenario, you have a hazy cornea, you have descending membrane folds, and the AC is quiet, there's no reaction. What could be the reason for that? As we all know, any cataract surgery, even the perfect cataract surgery, does cause endothelial cell loss around the range of 4.5 to 9%. So, if you have a pre-existing weak corneal endothelium which was not diagnosed beforehand, or if you had an ICE syndrome or reduced endothelial cell count following viral keratitis or endothelitis, we might have such a situation where the cornea becomes hazy on the first post-op day. In such a situation, it is nice to evaluate the other eye and look for any signs that might help you come to a diagnosis, especially for cases of Fuchs. Here is a patient of Fuchs endothelial dystrophy. It was in the early stage, so I did a phaco surgery. At 2 months post-op, patient had 6/12 vision and was unhappy. The reason being that if you look very closely, you can see the amount of catheter that is there in the central pupillary axis. Scenario 3, you have a corneal edema. Eye is soft and there's a shallow AC. The probable cause is there's a wound leak somewhere and the hypotony is the cause of that corneal edema. Dr. Jesse is going to talk on this, I think. Yeah. On the opposite end, you have a diffuse corneal edema, limbus to limbus. You might find small microcystic edema, bulle sort of thing on the epithelium. The cause can be reversed. Instead of hypotony, it could be a raised IOP. This is something a little bit more frightening. You have a post-op day angry looking eye, corneal edema from limbus to limbus once again. There's anterior chamber reaction in various grades. People might be dilated, IOP may be normal or slightly decreased initially. This is the dreaded toxic anterior segment syndrome. It's a sterile post-operative inflammation, mainly from irrigating solutions or intracameral drugs or from preservatives. There can be also endotoxin contamination of the sterilized instruments or detergent residues on the instruments. These can be very severe and cause corneal decompensation and trabecular macular damage. This condition has to be differentiated from endophthalmitis, which has posterior segment involvement. Dr. Paul is going to talk about TAS. This is the most dreaded stormy event in the first post-op day for any ophthalmic surgeon. You have a cloudy cornea, severe ciliary congestion, anterior chamber reaction, hypopyon, and then poor fundal glow. And this is none other than the dreaded endophthalmitis. And this should bring everything into aggressive treatment mode. Just to recapitulate, why this storm the next day? The surprise factors could be a DM detachment, undiagnosed corneal disease, TAS, endophthalmitis, or hypotony or raised IOP. Now, this is a scenario which is quite common on the roads of India. You see a truck which has undergone some accident, but by the grace of God, usually the driver is safe and unhurt, which basically means if you, as a surgeon, is leading an eventful surgery, then you should be prepared for the storm next day. Here are some situations where you are mentally prepared for a storm next day. If you have a hard brown cataract and you end up doing phaco and use a lot of energy, you are definitely going to get corneal edema as expected. Luckily, most of this resolve over time, but it always makes sense to do an SICS in these hard cataracts. Just to enumerate other conditions where you can have a STOMI first post-op day, you can have an inadvertent IOL endothelium touch. There may be excessive manipulation in a complicated cataract or surgical complications. There might be vitreous in the anterior chamber or retained lens fragment, which usually present with late and corneal edema. But then, if we go by our title, these are not uneventful surgeries, these are eventful surgeries. So this is the entire list of causes which can cause corneal edema after a cataract surgery. But once again, if you have to say uneventful cataract surgery, you have to exclude some of them. So the war is not over now. How do you manage these situations? See, management or treatment is always according to the cause. In case of mild edema, you can observe, you can add hypertonic